Well, good afternoon. My name is Chris DeWald, and I'm here in the beautiful town of San Antonio, Texas, at our 44th annual SRS meeting. I am to interview my father, Ronald DeWald, as a founding member of the Scoliosis Research Society. Dad, I got some questions here for you. First of all, I want you to start out by talking to us about your early life, where you're born, where you grew up, and we can get a little comfortable doing that.
Okay, well, I was born 1934 in a little town called Aurora, Illinois, which is a suburb of Chicago, about 40 miles southwest. But I kind of grew up all over the eastern United States. 34 through 44 were not good years, as you might know, and but ended up, surprisingly enough, back in Aurora for high school, and then on to college at the University of Illinois in Champaign-Urbana. Medical school was in Chicago, and I graduated in 1959. That's 50 years ago this year.
And did you end up then doing your residency? Well, actually, you could tell us about that whole medical school into on into residency.
Sure. Medical school is 55 through 59, and that's the usual medical school trials and tribulations that we all have. And I didn't know what kind of doctor I wanted to be. I took a rotating internship, which is really a mixed kind of an internship. And then I applied for residency in both orthopedic surgery and radiology, was accepted into both, and had to make a decision within a few short days, and decided on orthopedic surgery, and I think it was for the best.
Yeah, I would think so too. Did you flip a coin, or how'd you?
No, I just, I think one word that stuck in my mind was, you'll be working in the shadows all your life, you don't want to do that, and what will you do with your doctor's bag if you go into radiology? So. And you went to the University of Illinois for everything? I went there for medical school, and then I took a rotating internship over at Presbyterian St. Luke's Hospital, and then I came back to the University of Illinois for my residency program. And I was there for 2 years, and then I was drafted into the United States Army. That was Berlin Wall was built 1961, and Kennedy called up the reserves. There weren't enough doctors, and so they instituted a doctor draft. I got caught up into it. Fortunately, was able to delay my induction for 6 months. I didn't go in until July of '62, and those 2 years of orthopedic training allowed me to have an orthopedic surgery MOS number. So I went into service as an orthopedic surgeon, and was stationed at Valley Forge General Hospital in Phoenixville, Pennsylvania.
I don't remember too much about that. I was only about, 6 months to 2 years.
That's right. You were 1 year old when we went there.
Well, what then, obviously when you're doing your orthopedics, and that was interrupted during your time at Valley Forge, and you did orthopedics then too, yes?
I did orthopedics at Valley Forge. It was a wonderful experience for me there. It was a Surgeon General hospital, which meant that we had a lot of more serious and complicated orthopedic surgery problems that came up the line to the Surgeon General Hospital. Surprisingly, the chief of orthopedics had a colon cancer, so he was out of the picture for almost a year. The next in command took his place, and I took that man's place, so I was really ward officer in charge of all the orthopedic patients that were at that hospital. We had over 100 down patients, by that I mean in bed, and over 150 up patients that were convalescing from various and sundry problems. Most of these were all accidents. Most of them came from Fifth Army in Europe, and although we did have some Vietnam advisor soldiers that were wounded in Vietnam, this was before the real hot war developed in Vietnam.
Well, the main question being part of the Scoliosis Research Society is what kind of caught your interest into scoliosis?
Well, it's always it's always just an occasional thing that happens. I as a first-year resident, I was assigned a topic for a thesis that we had every year, and my thesis topic was scoliosis and pelvic tilt. So I immediately began to read up on that and discovered there really wasn't much literature on it.
What year was that?
That was 1960 to 61.
And you said you were a PGY?
I was PG2, PGY2.
Mm-hmm.
Yeah. And I liked it so much that the following year, PG3, I asked please to have another topic on scoliosis, and I was assigned. So I was kind of hooked early on scoliosis and its treatment.
And at that time, who do you think your early mentors were?
Well, the fellow that was doing the scoliosis work at our hospital, the university hospital, was a man, Claude Lambert, and he was an excellent surgeon as well as a gifted physician who patients all admired and looked up to.
When you think about scoliosis care back at that time, what do you think how it was like compared to now?
Oh, it's so different. It's hard to compare. In those years there was no internal fixation for scoliosis, so all of our time and effort was preoperative correction with either cast or traction or a combination of both. And many of these patients were down in bed for a prolonged period of time. We operated in the cast. We would cut big holes in the back of the cast so that we could maintain the correction while we did the fusion. It's interesting that the Cobb elevators with their long handles really were born of necessity because we were so far from the wound with this cast on the patient that they had to have long instruments to get down to the
Just
spine.
to get down to where you're working.
So the usual routine was see the patient, exercise the patient, perhaps put them in a cast, maybe a turnbuckle cast or wedge the cast, or use a localizer cast, or use a halo cast. All these things were used for preoperative correction, then cut the hole in the back of the cast, then do the surgery, then let the wound heal, then put the back of the cast back on, wrap them up again, and send them home for a while. All of the time they would be down, so some of these patients were down in bed for 9 months or more.
Yeah, with that in mind, what do you think has been the greatest changes? Just the getting rid of the cast, or what do you think has been the greatest change? Instruments themselves, or?
Yeah, I think instrumentation of the spine. I think Paul Harrington's rods and his publication of them and his promotion of them was, in my estimation, the dawn of modern day spine surgery. I've developed a little talk along those lines, and I was fortunate enough as a PGY3 resident to witness Paul Harrington operating on a post-polio patient, and he was able to correct the spine and fix the pelvic tilt in a matter of 6 or 7 hours, which what we would do without the instrumentation would take us 6 to 9 months to do that. So I mean, it was an astonishing thing to see. I was too junior a resident to scrub on the case, but I stood up on a box for the whole time and watched.
Well, thinking back, what do you think your major accomplishments in your scoliosis professional life were?
Well, I think there are several. First of all, I think you are an accomplishment. I think my son being an orthopedic surgeon and a spine surgeon is the greatest compliment any man can have in his own professional life. Then, of course, there's I developed a traction apparatus. I call it the Halo Hoop. It's probably better known as a Halo pelvic device. This was widely used by the people in Hong Kong, and Professor Hodson, who had come to Chicago and saw this on my patients and took it back home to Hong Kong, and they quickly developed their they made them right there in their own hospital workshop and put it on a lot of patients, and so their experience far outgrew mine rapidly. And he changed the name to Halo Pelvic. But I can talk more about that later. I think that other accomplishments would be the beginning of a spine fellowship for interested orthopedic surgeons that wanted to study more in depth about spinal deformity and how to take care of it. And other accomplishments would be the textbooks that I've been senior editor with Keith Bridwell, and another textbook on the fundamentals of spinal surgery that I published through the SRS. So, did I say the endowed chair? The Rush Presbyterian St. Luke's Medical Center, Rush University, I guess. I'm the 75th endowed chair there. Is entitled the Ronald L. DeWald Chair in Spinal Deformity Surgery. So that was an accomplishment that I'm very proud of.
And of course, within the SRS itself?
Well, being a founding member, being a past president, I think those are milestones that...
Of course. What year were you the president?
1988.
And do you have any specific memories of that year that you could recall? That
Yes, I remember we tried very hard to direct the society away from just adolescent idiopathic scoliosis and into a more broad spinal surgery research society. There had been an attempt to change the name of the society before me, but I tried again to call it, Scoliosis and Spine Research Society. So it was pretty easy to do, SSRS instead of SRS. I sent out a postcard to every member and said what we're doing, and actually a letter, and then an enclosed postcard that they could mail back, say, yes, I agree, no, I don't agree. Well, it was overwhelmingly that they all thought this was a good idea. And so we came to the meeting in Baltimore, and at the business meeting, I brought this up again for a vote, only to have some people adamantly opposed to it. And so I forget, I think John Moe made an impassioned plea that changing the name of the society would be like shooting his favorite hunting dog. So it didn't fly.
Well, speaking of John Moe and such, how did you first become involved with the SRS as a founding member?
Well, it was serendipity, I guess. Because of my interest in scoliosis, there was a continuing education course in scoliosis given by John Moe at the University of Minnesota. In essence, it was his showing us all of his cases on 2x2 slides and in a big auditorium. There weren't many of us, probably 20, 30 at the most. And towards the end of the meeting, which was 2 days, I believe, Dave Levine stood up and said, greetings from New York and from John Cobb, and why don't we start a scoliosis society or club or whatever. And John Moe said, yes, that's a great idea. If you write the Constitution and bylaws, I'll get it started. Well, that's what Dave did. And by 1965 or 66, letters went out to certain people that John Moe thought were good scoliosis people. And the mentor that I talked about earlier, this Claude Lambert, received a letter asking him to join. And at the time, he had a heart attack. And so he couldn't go to this meeting when it was being held, and wrote to Moe or called him on the phone, I don't know, and said he's going to send me, and if it was all right, in his place. So that's how I got the invitation, and so I went, and that's how I happened to become a founding member. Now, I was only 32 years old and just fresh out of residency training, and I was in awe of these gentlemen that were well-known names in scoliosis.
Tell me about that Then that very first meeting after you got that invite, you went there, you said you were in awe. What was the person, or who was the person that stuck out in your mind during that meeting?
Well, it was two of them, but John Moe obviously was the main driver of this whole situation. He got it started. He made Bill Kane do all the grunt work, but he was obviously the main feature. Paul Harrington was there, and it was, before Harrington worked with his rods, Moe was doing scoliosis much in the same way I described, with cutting the hole in the cast and, pre-op correction, etc. And of course, when Moe saw the Harrington rod, he immediately jumped on that bandwagon, and off we went.
How do you think the SRS meetings have changed over the years? I can't imagine that there's anything similar anymore.
Well, it's. I think what's happened in an effort to allow more people to be participants in the papers and in the posters, they've cut down the amount of time for the presentation. It used to be 8 minutes with 2 minutes for a rebuttal or discussion. Now it's 4 minutes and not much time for discussion. And I think that we've all become so specialized that it's hard for somebody who does mostly adult work to even make any comments about a pediatric case, and vice versa.
Yeah. You think about it, I remember going to those early meetings and seeing some of the guys, the icons, the founding members who would get up, and I think they were used to kind of debating and discussing, and I think I asked you this in the past, but who do you think were the most, or the best debaters among all those docs in those early days, or even now?
Well, it was always the Europeans more so than the Americans, who were. Alf Nachmanson was always someone to talk with and to argue with, and he wasn't afraid to join any side that seemed to be available for good comment. And some of the English who would come to our meetings also would be free to comment on all sorts of things.
And had no qualms of doing so.
None whatsoever.
That always seemed to make it much more interesting when those debates go on. When you think back, where do you think, in your mind, what was the most interesting location of the SRS meetings, either to you personally or professionally?
Well, the first time we went overseas was at the behest of Alf Nachmanson, and this was 1973. So we had been a society since '66. This was 7 years later. And for me, it was my first trip of any length abroad. After Gothenburg, Sweden, we went to Lyon for another part of this scoliosis meeting. And that was the birth of the French Scoliosis Society in 1973. They call theirs the GES, which stands for Groupe Etudes Scoliosis, and it's I've been to many of their meetings, and even though they're in French, you can follow along because of course many of the x-rays and pictures are there, and the French, a lot of French words are same as ours as far as spinal deformity.
Well, that's kind of the first two locations you were saying was Sweden and France?
Yes.
The same trip?
Same year, same trip.
But outside of those two, I know you've been to many places. I remember seeing those pictures when I was a kid. Out of all the things you'd gone to, was there any one particular place you really loved for whatever reason?
Well, I think Japan. I've been to Japan several times. Their culture is so different than ours. But yet they're such a modern, vibrant society that, and yet so polite. It's, I really am impressed with the Japanese.
Well, and the Halo Hoop won an award at one time. Did it at the SRS or was it at the Academy?
No, actually it was at the AMA convention. We were working with the Halo Hoop, and we made an exhibit of it. Now, it was, again, a happenstance. The director of I don't even know the name of his department, but a department that does illustrations, graphic design perhaps, but he was also making these exhibits for the different specialties around the medical center. This was at the University of Illinois. And came to Ray, who was the professor, and he said, well, maybe talk to Dr. DeWald, and do you have anything that we could show? And so I started to work with them, and with the idea of making an exhibit showing the halo hoop. So as it came together, as the ideas began to mount, this man helped to develop the exhibit and design, and I supplied all the medical information and background and photographs, and we even had a model skeleton with the halo hoop on it, and this kind of hung in the middle of the exhibit. And I took it to the AMA. It was held in, I think, Atlantic City, and it took us a while to put it up. Two of the residents came along with me. We had to take it out of its box and put it up. I mean, it was quite an undertaking. And lo and behold, unbeknownst to us, the graders or the people that make these judgments were coming by, and we got high marks, and we won the second place. So we won a silver medal, and actually I have the silver medal at home, and it was quite an honor. So we subsequently then took it to the Academy meeting, and we took it somewhere else, I don't know, and it was a good thing. We enjoyed it.
Well, I remember you said that Dr. O'Brien picked up on this. Did he see it at one of these meetings, or had he read about it? Or
Well, O'Brien picked up on it because he was working in Hong Kong when Professor Hodson came back from Chicago and said, here's what we have, and I had given Hodson some drawings of what we had done, and so they just, the Chinese are great copycats. I shouldn't say that, but they tend to be able to make things very quickly without any too much fuss.
And you spent some time over there with them as well.
I did. When they got going and were using this extensively, Professor Hodson invited me to come and spend some weeks with him, and I did. And you might remember the trip because I think you were 8 or 9 at the time.
I think I was 10.
10,
so,
okay.
Because Ronnie was only 2 at the time, so that's when I learned how to miss McDonald's cheeseburgers.
That's right.
What, if you think back, is there anything you would have liked to have done differently during your career?
No, actually, I don't think so. People have asked me that question in the past, and I've not been able to, probably spend more time with my family. I think that the younger generation now, I think even after your generation, whatever you want to call that, X or Y, I don't know what, but they seem to have a better idea that they're, and now with the new rules, the ACGME mandating that you can only work so many hours a week, I think it's better for rounder development of the individual. What it's going to do to their surgical skills, I don't know. I think that we're going to have to develop a little different system of teaching surgery than we've had in the past. In the past, it was always witnessing surgery yourself, but now there's so many other ways to do it, and the demonstration models get better and better. So I think we're probably going to track towards that end.
Well, I know we just talked about Hong Kong, but getting back to that, I know you've always had an interest in international surgical techniques for scoliosis. Do you think, can you tell me anything about maybe about going over to Europe, or what kind of got your interest in international surgeons?
Well, I think that, I don't know what happened in America, but we became kind of a closed shop. And the Europeans were making such giant strides in taking care of spinal deformity that we were kind of not taking advantage of that. Furthermore, in Europe, when you talk about a scoliosis center, it's a scoliosis center. So a person like Klaus Silke would have a scoliosis center in Bad Villigen, which is a little tiny town in Germany. but he'd have 140 patients in the hospital with all of them had serious spinal deformities, and he was treating them in many different ways. So it was educational, to say the least, to go over there and have a look, and the same way with the French and the same way with the Italians.
When was your first time, where'd you go first? In Germany or?
Germany. In 1979, I went and spent some time with Klaus.
Yeah, I think I remember some stories back then, but I think, was that when Dr. Lebicki went with you?
No, that was later.
Yeah.
That was a couple of years later. Yeah.
All right, and tell me, you think about how and why, well, tell me how and why you developed that, the first spinal fellowship, well, at least a year-long spinal fellowship, and what it has meant to you.
Well, I think it means everything. I soon realized that trying to take care of these spinal deformity patients and do what you do for them and to them requires a great deal of time and effort. And if you're going to treat more than one or two patients, you really need help. And you need somebody who's committed to this fact that they're going to take care of these patients. And I found that typical orthopedic resident, most of them were not really committed to spinal deformity surgery. So I thought we needed someone that was much more concentrated. And this is why I started this fellowship, and Dan Benson was our first fellow. He had been in Sweden on a year sabbatical from UC Davis, and I think was actually interested in a spine surgery deformity fellowship, and so he was our first fellow, and I couldn't have picked a better one.
Yeah, I was trying to count back how many fellows you had. It's clearly over 60, and that fellowship continues on, and I'm now part of it, and in training it's probably up over 70 or 80 now from
I'm sure
now part of that Chicago Spine Fellowship. Well, can you think of any advice that you'd give to us young spinal surgeons or middle-aged spinal surgeons?
Well, I think, I still believe in the old adage, first do no harm. I used to be able to say that in Latin, primum non nocere, I think that was written on the wall above the mortuary in the Cook County Hospital, where we would watch autopsies performed. And it's a good thing for a spinal surgeon to think about this. Some of the disasters that occur, you have to wonder if maybe somebody shouldn't be doing the type of surgery that was done. So I think every surgeon, no matter what age, should question, am I able to do this? What if this happens? What's my backup plan? And so on. I think that's true of all the good, successful surgeons.
Very good. I remember hearing those different sayings throughout the whole years. I thought you might, say the old saying about the young spinal surgeon versus the middle-aged versus the older spinal surgeon, but yours is much more eloquent. Today, what do you feel are the greatest challenges facing physicians taking care of the scoliosis patients?
Well, the challenge is time in hospital, operating room personnel, x-ray personnel, nursing personnel. To take care of any kind of a spinal patient requires a lot of people, and so the total continuum of care is only as strong as its weakest link. So you have to depend on a lot of these people. I can think through, all of my cases, and there's always the one that go wrong. There's always something that somebody didn't follow through with what they were supposed to do.
I unfortunately have lived that myself. Tell me, what do you think, how your family, me or Mom, the brothers, and Ann, how they've influenced your career? Because it's a loaded question coming from your son, I know. But,
it is loaded. I read, in going through Ann's things after she passed away, I found a thesis or something that she had written when she was a college student. I don't know why she still had it, but she did. And it was surprising to me that she said something like, well, the most important thing was Dad's work and Dad's medical school or something like that. And so we all made sure that his accomplishments were the primary focus of our family. So I thought that was good.
Yeah. All right, any other thoughts you can bring up here in the heart of Texas, as they say, to end out our interview? A lot faster than I thought it would go.
Well, I think that I see troubles ahead, actually, for spine surgeons. In the bills that are now before Congress, one of them I think will finally pass, and I'm afraid that the whole scope of how we've practiced our craft or our trade or whatever you want to call it, our profession, is going to change, and we're going to now be part of some group or organization that's going to be held highly accountable for not only for outcomes but for expenses and care. So you won't be the independent contractor anymore. You're going to be part of an accountable group. And where that puts the spine surgeon is probably not very high up on the totem pole of who's calling the shots. And the American College of Surgeons is well aware of this, and they're trying to make the surgeon the person in charge in calling the shots, but I don't think that's going to happen. You know that there are so many pediatricians and internists in this world that they seem to gravitate towards these kinds of organizations and seem to be the people who are running them and calling the plays. So I'm not sure what to do about it. I think it's just the evolution of care. We didn't talk about my endeavors to try to get the boards of orthopedic surgery to recognize spine as a special subspecialty. As you know, orthopedic surgery recognizes hand and sports as subspecialty and does award certificates through them. As you know, orthopedic surgery is one of 24 boards, and they're all under something called I'm blocking on the name of it. It's the American Board of Medical Specialists, ABMS. And the 24 boards are, the latest one to be formed, I believe, was emergency surgery. That was born because emergency medicine was born because no one wanted to really run into the emergency room and take care of the patient, so they made their own specialty. And now they're so busy that they don't know what to do. But as I said before, I think that the whole organization of medicine is archaic. We need to change that. We need to go to a system-oriented procedures so that if there's a cardiac system, then we should be able to treat it medically as well as surgically and all treat it down the domain and not have one medicine and one surgeon, etc. But those are controversies that are better left for another time.
So have a spine service.
Have a spine service. Have a spinologist, if you will. Now we We have people like a PM&R person who kind of functions that way, but they're really not educated in the spine. They're just educated in rehab. And we have pain doctors treating these people, but they're not educated in spine either. So it's not a very satisfactory situation. And they all are independent contractors, all billing the patient, which just confuses everything.
When did you start thinking about doing the sub-certification? When did that idea come to you?
It came when Tony Dwyer brought up spine boards. He just decided to independently declare that we should have a spine surgery board. And I thought, well, that's a good idea, but why don't we go through the organized system rather than just independently make a board? You know, there are a lot of independent boards around, but they have no backing by the recognized
the ACGME or
and the ABMS.
And that was where that textbook idea and the core course came from? From the SRS core course?
Yes, the advice I received was that you had to have a distinct entity, you had to have a core curriculum that would prove to the certifying board that you were a subspecialty. So I first decided to write up the core curriculum, but then as we were working along on that, we were going to present it as a course to the SRS. It became obvious that all this work we might as well make into a book, which we did. But then when we took the book to the Board of Orthopedic Surgery for the presentation and said, here's our core curriculum, the Board of Orthopedic Surgery said, well, this is a textbook, it's not a core curriculum. So I'm not sure where we were with that, but it was obvious that they weren't ready to go along with this kind of proposition.